Hi, and welcome everyone. This is our first medical legal session for the year. We took a little break in January and February, but we are back for season two. So, this is the first one, and the topic is on dental negligence, case studies, and practical advice on minimizing or mitigating incidents of negligence. And this presentation will be by Chris Shantini, Sebastian Pillay, who's a partner as S. Chris Shantini and Co. So this one is the first time it's targeted at our dental colleagues, but our medical colleagues are also welcome to listen in, and a CPD point will be awarded. Now it's early. The talk itself is around about 35 minutes, so got plenty of time. We are waiting for more people to come in live. So I'll just play a little clip from Dr. Shield, who has been the main organizer for these medical legal series of talks. So here's a little word from Dr. Shield, just a minute and a half, then we'll start the presentation.
We're Dr. Shield, and we do insurance differently than most companies. Things like simplifying details so it's easy to understand what makes us Malaysia's most innovative indemnity provider. As a Dr. Shield client, you'll enjoy comprehensive coverage with fewer exclusions. With some insurers, you'll only find out what's not covered when you make a claim. Our policy details are online and easy for everyone to understand. Competitive premiums that don't keep increasing. Many insurers increase their premiums across the board to compensate for losses. Dr. Shield limits the number of doctors insured from high-risk categories, so our premiums start fair and stay fair. Prompt dispute resolutions. We're pro-mediation because settlement and negotiation, instead of endless litigation, is better for everyone. Career and reputation protection. Typically, litigation can drain a doctor financially and emotionally. We limit the damage by both, so our clients emerge good names intact. And peace of mind, because a happy doctor is a good doctor. Our different approach to creating policies means we put you first, before us, so you can enjoy your career and sleep like a baby, even if you've just delivered one. Dr. Shield, insurance with a difference.
Okay, thank you, Dr. Shield, and let's get started. So what I'll do is we'll stream the pre-recorded talk, and then after that, Chris Shantini will come online and to take your Q&A. But before I do so, let's just go through some housekeeping slides so you all are not confused of what's going to happen. So for your Q&A, just get prepared with your Slido. If you're on a laptop, you can go to slido.com and enter this code 1269317. And that's our event code, and you can ask questions there. Or you can scan this QR code to reach the same spot in Slido, or if you have the app installed in your phone, the Slido app also will launch the event section. Okay. You can use the live chat in YouTube and ask questions or comments, or you have anything, you can give us feedback there. Like the audio is no good, video is no good, whatever. We're happy to get feedback from you. Please do subscribe to our channel if you're new, and because this way YouTube will keep you informed when we are going on next live. Next month's medical legal talk will be very interesting because it's very current and topical. It's something to do with non-delegable duty of care, private hospitals, and so on. Okay, now for CBD points, we already announced it. I think Dr. Shield would have broadcast to all the dentists who are in their contact list, and the pre-registration is also in our website, dops.my, under the medical legal section. I put a little link there, which is easier to remember. docs.my/dentist0324. So this is the pre-registrations or registration link for you to claim CPD points if you're a dentist for attending this talk. Please note this is organized by the Dental Practitioner Association. So if there are any issues like you didn't get your point, please contact the secretariat. All right. For the medical doctors who are attending, I will display an attendance link at the end of the talk, so you'll get a CPD point as well. All right. So without further ado, I'm going to now change the sharing to the recorded talk. Okay, give me a sec.
Good evening, everyone. Welcome and thank you for joining me this evening. I'm going to speak to you tonight on dental negligence with a few cases to illustrate the various areas that I'm going to touch on and essentially give you a bit of practical advice on how to handle these incidents and to minimize or mitigate the occurrences of these incidences. Towards the end, there will be an opportunity for question and answer, and I hope perhaps you could even give me your feedback on if anything's missed out or anything you'd like a bit of a further explanation or discussion. That would be great. So we'll start with what dental negligence is. Essentially, it's three broad categories of errors. They would be errors in diagnosis, or errors in advice, or errors in treatment, or it could be a combination of any of the three. And errors in these areas would be a breach of the professional duty of care owed by a medical practitioner, in this case a dentist or any other medical practitioner, to his patient. You will be aware that doctors, dentists all have ethical duties, which would be in your guidelines with the MMC and the MDC. And breaches of ethical duty can sometimes also be negligent breaches. For example, if a dentist were to recommend and implement treatments that are non-standard for a particular condition or unwarranted, that is both negligent and a breach of ethical duties. And when I say non-standard, I don't mean alternative medicines. Alternative treatments are sometimes allowed, but I speak of fringe treatments or unproven, untested treatments, treatments that may not be peer-reviewed. So the standard of care when it comes to diagnosis and treatment, that would be the Bolam test. And it is a very simple test. It's essentially if a doctor or a dentist has acted in accordance with medical practices, accepted medical practices, and that accepted medical practice is regarded as proper by a responsible body of medical men in that particular field, then that doctor would not be liable for negligence. Because, as we all know, things can go wrong. But if a dentist practice in the accepted and usual way, if things do go wrong, that in itself is not negligence. In respect to errors in advice, that standard is slightly different. It's the test held in Rogers and Whittaker, which is an Australian case that has been accepted here in Malaysia. And in the case of Fu Fiona and Dr. Su Fok Man, the federal court confirmed that test would be the standard to be used in Malaysia in evaluating whether the duty of care on advice, medical advice, has been breached in a particular case. So in this case, the test of reasonableness that we saw in Bolam, a reasonable body of practitioners, still applies. But the difference is, in the case of treatment and diagnosis, the court will accept what the respective body of doctors say. It's not for the court to decide what is appropriate treatment. That is, of course, within the ambit and knowledge of professionals. But when it comes to advice, it is for the court to decide whether the advice given was appropriate and suitable for the patient. This is so that is not to detract from the patient's ability to decide over decisions, make decisions about their own body, their own treatment. And that's why the court will decide. But of course, the accepted medical advice will be a useful guide to the court. The court will not decide so far out of the normal medical norms. So in this case, the opinion of the expert is relevant. The person, the patient's views is also important. The patient's stated outcome is important in determining whether the advice given was appropriate. Now, common causes of negligence in dental settings that we would see are, for example, errors in the administration of anesthesia or drugs. In the case of drugs, it could be the numbing agent, the lignocaine, or other drugs. It could be the medications given, the painkillers, or the antibiotics, or any other additional gels or other treatments that are given. There could be prescription errors or administration errors, as in application errors. Then for dentists, a very common case is improper tooth extractions. It often happens with wisdom teeth in particular, because those are hard to get at and difficult to pull out, or they may be impacted. Then there's also cases of a failure to diagnose or misdiagnosis. For example, there could be a gum disease present, but that may not have been caught by the dentist, or a tooth may have been diagnosed as rotten and not savable, not and perhaps that was an error. It could have been saved. Other common things that could happen is infections. During a procedure, infections can occur. And failure to obtain consent or informed consent is also a negligent act. If, for example, there's an option between pulling a tooth out or patching it up, the tooth might be borderline, then the decision might be for the patient to decide whether to wait a while longer and keep the original tooth, or pull it out at that time. So then you must get consent to pull out if the decision is to pull out, or to patch is less of a problem. But the failure to discuss and obtain the permission to pull out could become a problem down the line if the patient said, no, you shouldn't have touched my teeth, or rather shouldn't have pulled out my tooth. I wanted to keep it as long as I could, rather than going for root canals or other such procedures. Unwarranted treatment, for example, treating a healthy tooth, putting in crowns when the tooth is fine, pulling out a tooth that's healthy, or any other procedures that's not warranted. Telling a patient they might need braces and then charging them for it when really the teeth don't really need braces. There are not many examples of dental cases that are reported, because most of the time the claims are small. It's got to do with teeth pulled out wrongly, or infections, and so the quantum of those claims aren't very large, and they're generally settled. But there are very few that you could find if you trawl through our Malaysian case databases. The most recent one is Manjit Kaur Pratap Singh versus Dr. Nagaswaran Nachipan. This 24 2024 citation is actually the citation for the Court of Appeal. The High Court decision is unreported, but it was very much a case of findings of fact. So the Court of Appeal, when it went up on appeal, maintained the decision of the High Court on a majority decision, 2-1. Two judges maintained, and one chose to present a dissenting judgment, deliver a dissenting judgment. In this case, there was a 78-year-old lady who went to a dental clinic for a tooth extraction. She had been treated before that clinic, and she had been given lignocaine in the past treatment, and the second time she was also injected with lignocaine. She was also given antibiotic tablets prior to the extraction procedure. But before the tooth could be extracted, the patient experienced breathing difficulties and coughing. The dentist at that time felt that it could have been she was choking on the tablets because she had just taken the tablets, and he performed the Heimlich maneuver. She seemed to have recovered after the Heimlich maneuver to some extent, but not wholly. And the dentist had concerns about her condition. So, since she was a 78-year-old lady, so he felt that she should go to hospital, and he tried to contact an ambulance. But he had, at that time, the ambulance would take some time, but the patient, in the meantime, exited the clinic with her daughter and was taken to the hospital by the father of a patient who was also at the clinic, another patient. The doctor followed in his car, and he gave the history to the treating doctors. Unfortunately, the lady had a hypoxic incident, and as a result, she'd suffered brain injury and became bedridden. There was brain damage. A suit was filed against the dentist. Several claims were made, but among them was the claim that, firstly, the dentist failed to realize that the patient was allergic to either the lignocaine or antibiotics and had been experiencing an allergic reaction. Secondly, the dentist failed to have emergency drugs on hand to administer these drugs to recover her situation. And thirdly, he failed to follow in the car with the patient rather than following behind, so that he could treat her as the vehicle was going along. There were other issues, but these were the main ones. At trial, it was determined by the court that there could not have been an allergic reaction based on the facts. And the other two issues, it was also determined that for the levels of services he was offering, which was simple extractions, nothing under sedation, having the ambu bag, which he did have, was sufficient. And at any rate, the judge had decided that the need for emergency drugs was irrelevant, because while the patient was in the clinic, she had not collapsed and did not require the drugs. Similarly, the court did not find that the time frame between getting from the clinic to the hospital, which was about 10 minutes because it was very close by, and the condition of the patient, it would not have assisted for the doctor to have been in the car. So when it went on appeal, the majority decision, the two judges held that the findings of the judge was appropriate, but the dissenting judge felt that was of the opinion that emergency drugs should have been available, and the patient should have stayed in the clinic. The dentist should have kept the patient in the clinic, and then treated the patient and while waiting for the ambulance. That case stands now as it stands. There's no appeal to the federal court, so this decision is one that applies. And in coming to this finding, the High Court judge did refer to the minutes of a meeting between the Malaysian Private Dental Practitioners Association and the Principal Director of Dental Services of the Ministry of Health in March of 2021. The trial was in 2022. So these minutes were available at the point of trial. And the minutes showed that during the meeting, the Ministry of Health had clarified that emergency drugs and oxygen tanks would only be required if a dental clinic performs a procedure that requires sedation, and otherwise only an MVU bag is necessary. For an example of a case for failure of consent, this is not a dental case, but it's a general case on consent. It's important to know that if a dentist or a doctor fails to obtain the patient's proper consent to a procedure, and especially so in elective cases, any adverse outcome could lead to a claim not only for negligence, but also a claim for battery being the physical violence suffered as a result of the procedure. In this case, Gurmeet Kaur against Jaswant Singh and Tungshin, Gurmeet Kaur Jaswant Singh versus Tungshin Hospital and another. The plaintiff in that case, Ms. Gurmeet Kaur, had a uterine polyp. The gynecologist had, in the procedure, removed her entire uterus. Now, the doctor had claimed that he had advised the patient on the option of hysterectomy and that he got a signed consent. The patient denied this, and she claimed that she had been told that only the polyp would be removed, not her entire womb. The consent form that was signed was in a general form, and it did not state the type of procedure to be performed. And as such, the doctor could not prove that he had got appropriate consent from the patient. So the patient then successfully sued the doctor and the hospital for negligence and battery. The doctor also had not separately documented it in his notes. Unwarranted treatment, there's also a case. The federal court in the local case of Muhammad Rizwan Abdul Razak versus Asma Haji Muhammad Noor, cited the case of Appleton versus Garrett, an English case, where aggravated damages were awarded to the patients of a dentist for injury to feelings, mental distress, anger, and indignation. Anger, essentially, which was a result of the fact of them discovering that this dentist had been advising them that they needed various procedures on teeth that were otherwise healthy. And they had incurred these expenses. They had suffered unnecessary injury to the teeth that had the procedures done on them. And naturally, it led to shock, anger, and distress in all of these patients. So the court said that in this case, the dentist had acted deliberately in bad faith in order to obtain a profit for himself by concealing the actual condition of the plaintiff's teeth and telling them that it was worse than it was, so that he could carry out these procedures and charge fees. Now, the ways that incidences of negligence can be minimized are actually it's just a lot of just practical advice here. First of all, it's very important for all professionals, whether they be doctors, dentists, lawyers, engineers, to keep themselves current and update their knowledge, essentially continuing professional development so that they know what are the current treatments, what's best for the patient, what's cost effective, what risks are involved in each procedure, so that they can be in a position to give the best treatment and advice to their patients. Secondly, it's always good, whenever possible, to have a nurse or clinic assistant present during consultations or treatment, because this is essentially um, for the comfort of the patient. If you are a male or female doctor and the patient is a member of the opposite sex, so there's someone else there, to so that the patient is comfortable. Also, this nurse or clinic assistant can basically backs up what occurred during that treatment, because for a patient, a treatment that goes wrong is a very emotional and distressing situation. So their memory is often colored by the distress that they suffered during this period. So it will sometimes come down to, especially if the notes are somewhat lacking, will come down to the patient's word against the dentist's word. And that is why another person in the room who also saw and heard what went on is most useful. And it was, of course, um, an aid to memory as well for the dentist, uh, that this person is also confirming what he recalled and remembered. And in the case, that the Manjit Kaur case that we spoke of previously, the dentist had a clinic assistant who was present, and that clinic assistant testified as to what had occurred. And the judge in that case did accept the testimony of both the doctor and the dentist and the clinic assistant. Next, good documentation. I cannot state enough how important good documentation is. Essentially, detailed, accurate medical notes, operative notes, and nursing notes. Be thorough in taking the patient's history, because the history and the information that you have gleaned is what informs your treatment. So if certain aspects of the history that was given made you decide on a certain type of treatment over other options, but you didn't document the history that made you think that this was the best treatment, then you would have a problem, because you would be coming to court and saying, well, I wanted to do this because the patient told me this, but it's not in the notes. Then the reason, document, after you've documented the history, document the reasons why you have recommended this particular course of treatment. And then document the advice you've given to the patient and the patient's agreement. Don't just rely on the consent form, because often you have clinics with standard consent forms they're not really, they're too general and they're not going to help you in every instance. So you would need to add on. You could either do it on the consent form, add the extra details that are missing on the advice or the type of procedure, and or you can do it in the notes on the card, on the medical notes. But either way, just document the advice and the options given, and the plaintiff's the patient's, choice of treatment documented. Then you detail the procedure and its outcome. All these don't have to be, you don't have to write long essays, just bullet points. The important key words should go in. For example, advice, and then you can put one, or advice options, one, extraction, two, filling, three, whatever, yeah, bullet points. And then underneath plan, patient agreed to, say, extraction. And then you would put the whatever detail below that, the procedure, extraction carried out, was uneventful. This medication, this lignocaine given, the dosage, always good to document the dosage, any medication given, and also the post-procedure advice, what aftercare. For example, you may have told the patient, don't, for example, don't brush your teeth for a few hours, or don't eat certain foods for a few hours, or don't eat for a few hours. Document that is as the post procedure advice. Then, in terms of the medications that you give patients, make sure they're stored properly and disposed of, not kept in the clinic when they've reached the expiry date. Keep proper pharmacy logs, because your logs will be what save you if, for example, the patient says, oh, you gave me a drug I'm allergic to. But if your logs show that patient has received, I mean, you only use these types of drugs, and patient has had it before, for example, then those logs are going to help you. Maintain your equipment, service and sterilize them regularly. Keep, if these are um, specialized equipment that's serviced by external service providers, there ought to be a service log that you keep in your clinic, because that's proof that your equipment is in good order. And so if it breaks down for whatever reason in mid procedure, you can show that you did your best. You took reasonable care to maintain the equipment in the condition and state that it should be maintained in. The last two sometimes happens, and I would strongly advise against it. Don't pre-sign your medical certificates to make it easy for the nurse to issue the medical certificate once you tell the nurse, okay, go ahead and issue. Don't pre-sign it. The nurse can fill it up for you, but she should bring it to you for signature on the spot. This is a good way to prevent abuse. Finally, do not allow unqualified persons to dispense prescription medication. If you allow, say, clinic assistants to dispense strong prescription painkillers or strong antibiotics, and the wrong drug or the wrong dose is given, there could be very serious outcomes. So if the clinic assistant is going to give it to the patient, you need to tell the patient, this is the drug I'm giving you. The clinic assistant will give it to you, but have the clinic assistant bring it to you, show it to you before she gives it. That way you know that it's done without, it's done under your supervision. Because you might be in a sterile, you might need to keep your hands sterile, so you can't go and actually go and dispense the drugs yourself. But it can be done under your supervision. You can ensure that it is done correctly. You can ask the nurse to show you the bottle, show you the tablets, show you the expiry date. Make sure that what's being given is correct. A good thing that in fact it's mandatory now, but that you should all have insurance. But it's not just you buy the first insurance that comes to hand without really thinking about it. The reason I say this is you need to ensure that your insurance, whatever package you choose, the cover is sufficient and it's up to date. What do I mean by sufficient? For example, sufficient must be the cover amount. It should be adequate for the type of services you give, because the type of services you perform would determine the type of risks you take on. For example, an obstetrician and gynecologist who delivers babies has high risks because you have in your hands the life and care of a mother and the unborn child. So when things go wrong, it can go very badly wrong to the mother's life or the child's life or both. So you would have seen awards that run into the millions of ringgit for these types of claims, obstetric claims. So for obstetricians, they really should buy a cover of several million ringgit, as essentially as high as they're able to afford. For surgeons, similarly, they should seek high cover because surgeries can be life-threatening. A GP may not have as high a risk profile as an obstetrician or a surgeon. Similarly, a dentist who does not perform procedures under sedation. Dentists who do sedation do have high risk. They would be at probably a similar level as an anesthetist, that level of risk. But it's always best to err on the side of caution. So get higher insurance cover if you can. I think currently the minimum cover is 1 million ringgit, but I would advise against it if you can afford higher cover. I'll take that Majid Kaur case as an example. That was a simple tooth extraction, but the patient, for whatever reason, suffered a hypoxic incident and became brain damaged. So the claim that came was in the millions of ringgit. So if, for example, a dentist in that situation only got cover 1 million, he would be finding himself exposed for millions of ringgit because the insurance is only going to cover the first 1 million ringgit. So I would suggest, even if you don't do sedation, to get as high a cover as you can afford. And bear in mind that awards are going up, firstly because of inflation and increased cost of living, and now services, the treatments required by the patient, long-term treatments for recovery, medical care is very expensive. So be sure that your insurance is adequate for the kind of risks you're taking on. And when I say the policy should be up to date, make sure there are no gaps in cover. Renew your policy back to back. Do not have spaces in between, because in between, your policies are claims-based policies. So when the demand comes, or when the writ comes, or when, or if you make a notification of circumstances giving rise to a claim, that is when your claim is taken up by the insurer. So if when the claim comes you don't have cover, say you're in between renewing insurance, you have a problem. The insurer may well say, I'm not going to cover this. Or not it. So you must make sure you have no gaps in cover. Similarly, the retrospective cover date, the date on your policy, should cover your practice period. So because it's a claims made basis policy, the claim may come in today, but it could have been for something that happened 4 years ago. So you must make sure your policy has retroactive cover that covers the period you've been in practice. So all these things. You can also ask, some policies may not cover aggravated damages, so make sure your policy has that, so that you cover yourself in case a claim is filed for aggravated damages. Now, I do not think there's any policy out there that's going to cover exemplary damages, because exemplary damages are only awarded to punish the doctor for intentional conduct or criminal conduct. So insurance policies won't generally cover that, but there are policies that cover both the special damages, general damages, and aggravated damages. So measures to mitigate damage once an event has occurred, a negligent event or potentially negligent event has occurred, or even if no negligence has occurred, you feel the patient might make a claim because the patient is dissatisfied with the treatment received, then there are things that you can do to minimize the damage or the loss. So if the patient is still under your care, make sure that the patient is stable and receiving appropriate treatment. If the treatment required is beyond your capabilities, make the necessary referrals to the appropriate specialists or hospitals. Check your medical records, ensure that all the notes are up to date and accurate. Late entries can be made if warranted. So if an event has occurred and or the patient comes back a few hours later saying, oh, this has occurred, that has occurred, you didn't tell me this, doctor, look at my cheek, look at my jaw, or something is happening. Go back, review your notes, make sure everything is there. If it's not there, you can put in a late entry with the details that you have omitted. Something added the same day or the next day generally is not a problem, but you can't really add something in weeks or months later. But if a patient does come back to you weeks or months later, document it in the notes of the patient coming back and their complaints. And you would probably need to, if there's anything missing, you might want to still put it in to say that this was there, but its value is very much diminished when there's a long period of time, if there's any errors in the noting, because after a patient comes and complains to you and it's not the same day or the next day, it can very well be viewed as a self-interested entry, and its evidential value would be low. So check also that if it's a good practice for nurses who've treated or assisted the patient to document their interactions with the patient. So check also that they have done it, or if you don't have that process in your clinic, if you know a complaint is going to come, get your clinic assistant or nurse who assisted you to write up a little report of what the nurses or clinic assistants' interactions with the patient were, and what uh, the nurse or assistant observed or heard. Then you would then, after that, you initiate the relevant reporting procedures if your clinic or hospital has one. For example, if you might have a complaints procedure, the patient has made a complaint. So you assist the patient. This can happen in tandem, of course, when the patient comes to complain. You assist them with the complaint first, initiate the complaint procedure. If the patient doesn't say they want to make a complaint, but just comes and says, I'm going to sue you, doctor, because this, you can offer them uh, the complaint process. If they, of course, if they refuse, there's nothing you can do. But then you report. You make a report to the relevant, whether it's the management or of the clinic or hospital, that this has occurred, so that they can then start their documentation and their own internal investigations and procedures. Of course, if you're a sole proprietor and it's just you, then you do your own review and assessment. Um, then, of course, you inform your insurer at the earliest opportunity. If because claims-based policies aren't just only when the demand or the complaint or the writ comes. It is, if you expect a claim to come, you can inform your insurer. So then after that, conduct your own review of the medical records so that you are in a position to address any issues that may arise. And in the event the patient requests a report on the incident, provide a factual and accurate account of what occurred, and keep your insurers informed through this process. When you communicate with insurers, there are three instances in which you would be in touch with them in negligent or potentially negligent cases. One is when you know something has gone wrong in a procedure or in the giving of medications, and it's likely, because the outcomes were serious, it's likely that a complaint or a claim is going to come. So in those instances, you don't have to wait for the demand. You don't have to wait for the disciplinary complaint. You don't have to wait for a writ. You inform your insurer. And once you do receive a claim, and there are times when you won't know. Sometimes you think everything's fine, the patient goes off, something occurs with the patient, but the patient doesn't come back and tell you. Next thing you know, a demand comes or a writ comes. So then you must act quickly, inform your insurer. With the demand, the insurer might be able to assist you in responding to the demand. With the writ, bear in mind, there's 14 days from the date of service to enter an appearance. If an appearance is not entered within 14 days, the plaintiff is in a position to get judgment in default of appearance against you. So don't treat court processes lightly. Similarly, with disciplinary complaints, they will also have time frames. So don't treat them lightly. And if a disciplinary complaint comes in, notify your insurer as well. Most policies have defense cover for disciplinary complaints. And more often than not, disciplinary complaints are followed by negligence suits in court. The notification process is simple. Contact your agent for the initial notification. Your agent will inform your insurer, and the insurer will either come back to you through the agent seeking information, or they may contact you directly. They may also ask you to write a report. So if you anticipate a claim coming, it's always a good idea to actually prepare ahead and prepare your own report. The report you prepare for the patient and the report you prepare for the insurer will be different. The report for the patient is a medical report. It will always be factual. The report you give your insurer will be factual and should also include your opinion on what may have gone wrong or what did not go wrong, but the patient thinks has gone wrong. So that helps the insurer assess the situation. It is very important that you do not admit liability or make promises of reimbursement or compensation to the patient without first getting the insurer's approval, because if such promises are made and there is no liability, the insurer will reject your claim. And the insurer would also be better placed to advise you on if there is negligence on what the appropriate compensation might be. So this brings me to the end of this presentation, and I'll be happy to take questions from you now. Thank you.
Well, thank you for staying with us, and I'd like to invite Chris Shantini to the stage. Hello, Chris. Hi, how are you?
Dr. Ellen, I'm good, thank you.
Okay, I think it was a great presentation, and we are now at the Q&A section, and let's see whether there are any questions in our Slido. Oh, nobody has made any question. Oh, yes, there is one. Okay, so let's one question here. Should the dentist document a patient's refusal of extraction advice in case of a flare-up?
Yes, definitely they should, because the patient is acting against advice. So what you advise is documented, and what you advise, what's agreed upon is documented. And when advice is not accepted, that should also be documented, because then the patient, if anything goes wrong, it was based on his own or his or her own decision. Uh, as long as it's made clear to him what the consequences are of not following through with what has been advised, and he still decides to not listen, there's not much you can do about that. Just document it, because that protects you as well.
Can I ask something about the first case, Chris? What is
Yes, sure.
exact? What's the cause of the lady's choking and difficulty in breathing? It wasn't very clear to me. Was it an allergic reaction? Did she actually aspirate something? Or
That's a
so
very good question.
ultimately, from medical point of view, I mean, was the appropriate action taken depends on what was the ultimate diagnosis.
Yeah, it's a very good question, but the only causes for allergy that was advanced at the trial level was either the tablets, the antibiotic tablets, or the lignocaine. The but for a number of reasons, the trial judge didn't accept that it could have been an allergic reaction. In the case of the lignocaine, she had been injected with that for a previous extraction, so he found that she didn't have an allergy earlier. Of course, the judge did accept that at different periods in your life you may or may not have an allergic reaction to certain drugs, but he then also took into consideration the evidence that the patient was still exposed to lignocaine after the event, in that she was on a Ryle's tube, and the Ryle's tube was coated in lignocaine, and she had no reactions to that. So on the facts, the judge dismissed a possibility of allergy to lignocaine. When it came to the tablets, tablets, as you know, it's about a question of absorption. It's once it's absorbed into the bloodstream, that's when the reaction occurs. So in this case, the lady started coughing, according to the clinic assistant, right after taking the tablets, and according to the dentist, within 1 minute. The doctor said within 4 minutes. um, all of which are too short a period for it to be an allergic reaction. And in the notes in the notes at the hospital, they entertained two possibilities: uh, allergic reaction or choking. Um, Although the doctor who was subpoenaed to testify was of the view was probably an allergic reaction, that was somewhat complicated because he was not the doctor who treated at the point of emergency, but saw her for the first time the next day. Um, but the judge accepted that it was some sort of allergic reaction, uh, but not not as a result of anything administered by the dentist. So then the question then shifted to, okay, if you didn't cause this episode, did were you negligent in managing the episode after that? And the judge found on the facts that in this case, no, the dentist had not failed in his management of the situation, given the circumstances of the patient leaving the clinic with the daughter while he was still on the phone trying to get the ambulance. Um, so
I
he
mean,
said
this
you.
rather, to be honest, from a medical point of view, I have I mean, not just making any criticism or whatever, but it's very odd if it's not an allergic reaction, then it was a sudden reaction to some event, maybe a medical event, we don't know, you know.
Yeah, because she
I
was a
mean,
78-year-old
let's say
woman.
a
Yeah,
patient comes in, an elderly lady comes into a dental clinic and then has a heart attack, and then
yes.
and then collapses, and and this is unexpected. I
But
mean,
this
we
is
don't
the
have a
thing.
crystal ball, and
That's
then
true.
will not dentists be liable for something they're not trained to handle
No, but
in the
there
future?
are
You say everything we should be able to
no, no,
handle,
but
but
this
that's
is
not
the thing, right?
in real life.
In this case, she didn't collapse in the clinic. It
Hmm.
happened later, but she was in distress. Um, yeah, I do agree with you. Whenever what's this? Whenever the negligence or otherwise of a doctor is determined, it is with reference to that doctor's field of expertise. But at the same time, every doctor should be able to perform basic resuscitation. Every doctor should be able to use an ambu bag. Every doctor should be able to do CPR, take a patient's vitals, make an assessment of the patient's condition, a sort of triage, shall we say. And if it is beyond that doctor's capabilities, obviously call an ambulance, get help, and then try and manage the emergency as best as you can with what you have. Yeah.
Sometimes easier said than done. You call the ambulance, you take longer than the time it takes to transport the patient to the hospital directly.
That's true.
But
In this
anyway,
case,
I think we better
yeah,
move on to there are more
yeah,
questions coming up.
yes.
Should the patient's signature, should we get a patient
Oh,
signature that he declined? I guess it's related to the first one where he
uh,
refused extraction advice.
um, well, if the patient is willing to sign off on that, because you see, hospitals, when someone's in a hospital and they require treatment, they've been admitted, but the patient wants to go home, they issue a release against medical advice. So similarly, you document and say this patient, against medical advice, has made this decision. You don't really need to get his signature. It's just you document it. Um, it's not mandatory for you to get a signature, and it could cause problems. You might get a very angry patient. Just document it yourself. Um, I think that would be sufficient. And of course, you have your clinic assistant who's present, who also hears the patient not listening to your advice. So
Okay.
if they have if you have clinic assistants or nursing notes, and I do see some dental clinics or centers do have it, they too can document patient decline treatment. Doctor gave
Okay.
options, patient decline, that kind of thing.
Um, okay. So document but signature not required. Will insurer cover if the patient prefers to get compensation instead of going to court?
Now that is a case by case question, the answer, I should say. If you involve the insurer with the process, tell them what's going on, and it's a clear-cut case of negligence, often the insurer will either through the dentist or themselves directly, or they might appoint a lawyer to act for the dentist, will actually discuss and negotiate a settlement with the patient. I mean, I've had this happen several times with dentists. We will have the insurer will say appoint a lawyer, and essentially a negotiation will take place, and it will be settled without having to go to court.
Okay.
But if it is defensible, the insurer is not going to agree to you paying just to get the patient off the
mm,
back. Um,
mm.
so yeah,
So it all depends case by case whether there's a pre-trial settlement or
whether
some other
negligence is
form of.
apparent, if negligence is
Mm,
apparent, insurers will try to settle without it going to court, unless the
mm,
patient is unreasonable in their figures. Then you might just have to go to court to sort out the
mm,
sum. Or if it
okay.
is there's no negligence, then the insurer wouldn't be paying compensation.
Mm. Can you comment about vicarious liability? That's our typical indemnity help if our staff or associate made a mistake.
Okay. Okay, there's two types of policies, right? There's the policy that the medical doctor takes out for their own medical malpractice, and sometimes those policies might have locum clauses, but that is peculiar to that doctor. It doesn't cover the hospital or the nurses. Then you have hospital or medical facility policies. That's a separate policy, uh, which I would strongly recommend all hospitals, clinics, facilities to buy, to purchase, even sole proprietors, because it might not, the negligence might not be to do with your treatment. It could be with something that went wrong in the clinic. um, uh, the nurse made an error or something. So then it's the clinic that gets sued, and you, as the sole proprietor, become responsible. But the nurse's errors are not covered by your own personal indemnity insurance. A clinic policy will cover that situation. So even if you're sole proprietor, it would make good. It would be advisable to have both your medical malpractice cover and a clinic cover. So yeah, so coming to the question, if you purchase a clinic or medical facility policy which has the appropriate endorsement cover for staff, medical equipment, because those things can go wrong as well if it's not properly maintained, um, then it will cover under that policy, but it will not cover you. Your personal medical malpractice policy will not cover you for um, clinic equipment failures or staff errors, unless you were supposed to supervise that staff and you failed. You can be both. You see, you could have two types of liabilities. There's the liability of you as a doctor for failing to supervise the staff and say in dispensation of the medicine. And then there's the liability of the clinic, um, for who are vicariously liable for the staff. So it really it depends on how you are sued. Are you sued in your character as the treating doctor, or are you sued in your character as the owner of the business? Your medical malpractice policy for doctors will not cover you in your capacity as owner of the business. That requires a separate policy. So it really depends on the type of insurance you bought.
So the message is, say, with dentists or even doctors, you run your own clinic, it is advisable to have a separate clinic insurance cover
That's
in
right.
case the clinic is sued as a separate entity. Okay.
That's right. Say
Yeah.
you bring a locum in and you didn't treat the patient and things go
Mm,
wrong, the clinic is sued, uh, but not you in your capacity as treating doctor. So your malpractice policy is not going to kick in, but your hospital or clinic policy will if you have one.
okay. There's another question. Can a consent be taken when a patient enters the treatment room for consultation, even before other treatments are carried out? Separate signature needed for others.
Can a consent be taken when a patient? Okay, you
Not sure
take a
what it means.
consent. Okay, I'm
Mm,
not sure what it means, but it's just general advice. You only take a consent once a procedure has been advised upon and accepted by the patient. So if you're going to do the procedure, you take the consent. If you're not going to do any procedure, you don't go and get blank consents. That's not going to work for you, because the consent must come with the go in tandem with the patient's agreement to the procedure and understanding of the procedure as well, and its consequences, because you obviously advise the patient on the risks of the procedure, which, coming back to documentation, you must also document any risks of procedures that you've advised to the patient, so that it all ties into whether this patient understood the procedure and actually consented to it.
okay. Yeah, that makes sense, and that's usually the case. Don't know of any case where we take consent before seeing the patient. Anyway, um, there's one question on YouTube before we wrap up because it's 9 o'clock already. So, madam, in your general opinion, how long do these legal cases drag on? And over the years, the memory gets jaded, even though documented. It's very so true.
It's
And it's
absolutely
statute of thing for non-obstetric cases is 7 years. Is that right? 6 or 7 years? I forget.
okay. General limitation for negligence is 6 years
Six
from
years.
the Negligence Act. However, it becomes complicated when you're dealing with minors, because the limitation for minors runs from 6 years after they reach the age of majority. So if this is like a 10-year-old child and you did something and then the arm has become, say, for example, uh, you become disabled, you can't use the arm. Child is 10 years old, but the suit can come when up to when the child is up to the age of, say, 24, because you have 6 years after the age of 18 to file. So that is the filing. But once it's in court, because he's speaking about legal cases, once it's in court, in the bad old days, it used to take years and years and years. But now, with our courts having e-filing and more active case managements, and there's a lot of awareness of how time affects both the memory and also the plaintiff's rights or the defendant's rights. Um, these cases, in general, can take between, depending on how complex it is, between 1 year to 3 years. Um, of course, we usually 1 to 2 years, right? Um, and if it's not too complicated, 1 year or so. Um, but the one with lots of witnesses might drag out a bit. But in recent years, it's been about, on average, within 2 years at the trial level. Appellate levels, you would add a year or so, going upwards, depending on how quickly the judgment comes out and stuff. It's not usually the case that it takes 10 years. For example, my experience in recent years, from the start of the writ being filed to the, say, in the Sessions Court, to the, say, it's appealed all the way to the Court of Appeal, um, the whole process took 6 years, five to 6 years. And that's not too bad considering you're talking about three levels of courts and a trial. Of course, COVID has affected that track record, because for a whole year plus we were having so many lockdowns, so cases did drag out. So I do have some 2019 cases that have just finished. So yeah, those took 4 years or so, but they are getting finished now. Um, so I guess I hope that answers the question.
Yes. Thank you very
Yeah,
much. I think before we let this webinar drag on too long as well, so we better put an end to the questions. So if there are further questions, maybe you can put as comments to the video, and I'll forward it to Chris Shantini if she can uh,
sure.
oblige. Yeah. But I think we have to say uh, we have to put a stop now. So now this comes to the part of claiming CPD points. So let me share the slide. So for the dentist, already we've um, given you the pre-registration link. It's not too late. You can still register. I'm not sure how long the dental association will entertain the you to submit your claims through there. For the doctors, we here's the link to register. The QR code is just the the code to that link. Okay, this is not the code to be scanned by the MMA app. So you go to docs.my/2700324. It will take you to a Google form, and then please fill in your details. This uh, when by filling in, it acknowledges that you watched the entire presentation, and then we will upload the points in 1 or 2 days. Okay, please note this link will expire by at midnight. And for those of you who happen to catch this video after the live presentation from tomorrow onwards, we will have a method for the medical doctors and not the dentist, sorry, because this is working through the MMA app. If you can comment on the video that you've watched it, and then we will provide you with a way to claim the point. And it will be a pinned comment in the video later. So I hope you all enjoyed the talk. I've learned a lot as usual, and I'd like to thank Chris Shantini for her excellent presentation, and thank you all for participating and also obviously you all been paying attention because usual quite a number of questions, and we look forward to seeing you in the next one. And next month will be quite interesting because it's something about hospitals and non-delegable duty and something about the recent big case which came out in the news. So hope you can join us next month. Watch out for announcement in Dobbs about the time and the date of presentation. So I wish everybody good night and good night to you, Chris, and thank you once
Right,
again.
okay, thank you.
Okay, so good night, everybody. We're going to end the stream right now. Take care. Bye bye.